morning. Welcome to our annual health fair. We're so glad to have you join us today. We've had over 100 seniors out here today. We have over 24 vendors. We have Windsor House, we have Century Bank, we have the VNA, we have Cambridge Health Alliance out here. Our lead speakers today are going to be Dr. John Bruce and Dr. Daphne Schneider, who are geriatric specialist doctors. And this all could not be put together without Chris Kowalowski and Mimi Delghezi. And Mimi, thank you so much for everything you've done. You've done a wonderful job. Mimi was kind of thrown into this job, and she's done really great things. Mimi, want to tell us a little bit about what's going on today?
Sure. So today, like Cindy mentioned, we have a lot of vendors who are from the community who work in health and wellness, and they're coming together to essentially show our seniors and our older adults the resources that are available to them in terms of family care, in terms of health, and a variety of kind of what's out there in the community and how they can help our older adults and our seniors.
So maybe tell the folks out there a little bit about what you do here at the Council on Aging.
Sure. So my job here at the Council on Aging, I'm a nutritionist. So I put on the nutrition classes, and I also am an exercise instructor. So I work with the Fit for Life program. We have anywhere from about 8 to 12 folks in classes. We run 3 or 4 different classes. And so I teach nutrition. I put on nutrition demos. We do some cooking. We talk about, healthy ways to make lasagna. So we do a lot of different things and kind of bring healthy eating to a place that is fun, and let everyone know that eating healthy doesn't mean eating cardboard.
Which she has proven with me. There's lots of things she's made me try. She's won me over, she has. She made a fabulous vegetable lasagna, and I absolutely was like, I'm not trying that. And then I had 3 helpings. So I'm not sure that was really healthy. It passed the Cindy test. The nice thing about it, too, is Mimi, so I'm an individual senior, and my doctor said my cholesterol high. I need to be on a little bit watching what I eat. Who do I go to for a one-on-one?
That's a great question, Cindy. In fact, I do nutrition one-on-one counseling. I know. Lucky you. So Mondays and Wednesdays for an hour, you can come in and talk to me. And it's really nice because you get specific, customized sort of guidance on how to set up your eating, or looking at any issues you might have with nutrition or medicine and how that might relate to your eating habits or things like that, or even your exercise habits. And as we get older, things are going to start to change. Our taste buds change, our desires to eat change, our appetite changes, how much we exercise changes. So it's nice because you can both be in a group setting during the nutrition classes if you want, and you can learn from other folks who are also going through the same, sort of aging journey. Otherwise, you can come talk to me, and it can be a more customized, private session, and really we can target the specific needs of individuals.
So Mimi has a lot to offer, and as she was saying, the Fit for Life program, we have 4 different classes here at the Holland Street site. We have a class at the Cross Street site, which is our multicultural site, and then we have one at the Ralph and Jenny Center. So there are many classes, many things, but Mimi only does nutrition once a week at each of those places. So she has the other time that she has for the one-on-one. So I'm going to let Mimi scoot off and visit and do what you need to do. Thank you so much. You've done a great job. Really appreciate it. Oh, thank you. Teamwork. And I do want to thank the rest of the staff for all the hard work that they do. I hope you'll share and go around and visit and see all the tables if you have the opportunity to see the show.
Hi, I'm Denise from Windsor House Adult Day Healthcare Centers. We have 2 centers, one in Central Square, but downstairs from the Senior Center that is open from 8:30 to 3. And then we also have a center at Sancta Maria Nursing Facility that's open 8:30 to 3, and we also have a program 11 to 5. We provide nursing from the moment we open up to the moment we close. We do everything from blood sugars to vital signs to wound care. We also have activities. We have podiatry, and we have a breakfast and meal services there, pet therapy, speech therapy, physical and occupational therapy, and we're open Monday through Friday And it's not also a good service for our clients, but also for caregivers who have to take care of somebody for 24 hours to give them a break.
Hi, I'm Jeannie Scopper, and I'm here from Century Bank, which was founded right here in Somerville in 1969. And I am here today for the Council on Aging Health and Wellness Fair. And what we're providing is banking information, as well as retirement planning and a host of other services. So we're here just to say hello to people, and see if there's anything we can do to support them in their financial health.
Hi, my name is Deb Picciuto. I'm with the Cambridge Health Alliance, and we have a core of people who are called our volunteer health advisors, and we help train them and put them to work in the community. Today we have staff because some of our volunteers are at their day jobs. But we do a lot of community work in settings like this to do early intervention related to high blood pressure, cholesterol, and we try to do advising to help people make sure they do follow up with their healthcare providers. We're part of the multi-site system of the Cambridge Health Alliance with the community health centers, Somerville Hospital, Cambridge Hospital, and Whidden Hospital. And we have been in the community for years, and we are very happy to be here in Somerville. I was born here, so I'm happy to be here with you today. So I'm with my colleague Layla and Hugo and Chong Min and my other colleague behind you there, Victoria. And so we hope that you continue to create these offerings for the community because it enhances awareness and brings people to become more aware of what's preventable and what they can deal with in an early phase to enhance their well-being and long-term outcomes. I have a 99-year-old mom, so prevention is everything. Thank you for having me today and the rest of our staff here.
My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And we have all services for folks, they call us older adults now, but it's much more forgiving. So we have a lot of different programs for folks, and we also have what we call a PACE program. And PACE means Program of All-Inclusive Care for the Elderly, starting at 55. And it takes care of people right through to the end of their lives. We're both the insurer and the provider. For people under certain income guidelines and asset guidelines, they don't pay anything for eyeglasses, hearing aids, dentures, walkers, wheelchairs, canes. All health and health-related services. It's a team. We're federally and state funded and regulated, and the team guides people and whatever caregivers they have on board right through to the end of their lives.
Hi, my name is Jennifer Wenger. I'm the Community Relations Liaison for Right at Home. Right at Home is a non-medical home care company that opened going on 14 years ago in the North Shore in the Merrimack Valley, and we also just opened an office in Somerville. So we are very pleased. I'm very proud to be local. We work with the Somerville Cambridge Elder Services, and what we do is we do non-medical home care. So we can do as little as 1 hour of care a day to 24/7, anywhere in between, and live in. So we can help with personal care, homemaking services, private duty, companion care, and basically anything that you might need, any light housekeeping services, help with meal preparation, medication management. And we have a lot of great programs ranging from help with elective surgeries such as knee hip replacements, orthopedic surgery, COPD and CHF program. And we have an excellent hospice program that all of our caregivers are trained in serving the community with that as well. We work with the Harvard Medical School. We are just very privileged to have a 3-year pilot study program put out this year. And they chose us out of all agencies nationwide, so we're really thrilled. So in 3 years we'll come back and maybe present the studies of that. And it's an excellent agency right at home. Our mission is to have the right people with the right services, the right approach, and the right mission to keep folks right at home.
This is the time when you get your pen and paper and write down all the great activities that we have happening. We're already talking about 2016. Can you believe it? I'll be right back. So thank you. We're so glad to have you back. And again, we're having a wonderful time here. We have flu shots. We have blood pressure, glucose screening. We have Reiki, meditation. I'm going to go do the meditation myself. But we have lots of great things happening. So take a look around. Walk with the cameraman and see what we have to show you today.
Hello, my name is Laura Nichols, and I'm the director of the Cambridge Consumers Council, and I'm here with my associate Patrick Williams, and we mediate complaints working in cooperation with the Massachusetts Attorney General's office. We handle all types of complaints, retail sales, home improvement, landlord-tenant, identity theft, credit, and we're here to hopefully educate consumers about their rights and what they can do if they come across a scam.
I'm with Samaritans. We're a suicide prevention organization. We're based out of Boston. I'm here to provide resources for when someone might be in crisis. We have a 24/7 helpline, free, confidential, anonymous. You don't have to be suicidal to call. You can call for whatever reason. A lot of people call if they don't have someone else to share worries or concerns with. People call to give us good news. We also have outreach and education, so we teach people warning signs, risk factors. One of my favorite brochures here is the Taking Care of Yourself and Others brochure, because it has good resources for when there's someone else in your life that you might be concerned about. And that's about it.
So we're from West Somerville Denzil. We're a Denzil office located by Powder House Square. We're here to represent the office for the seniors and let them know that we have plans for seniors. We offer discounts. We do all our work in the practice. We have a denture lab. We do our crowns, everything we try and take care of in the office.
So I'm John. I'm from Tufts University. We're doing a healthy aging research project right here at the Somerville Council on Aging. We've done a lot of research looking at exercise programs and the effect of exercise on aging in the clinical setting, and now we're trying to move it out to the community. So we've set up this program here, and we're trying to look at this healthy aging program to see how it can improve mobility, balance, and other components related to aging. So if anyone's interested, let us know.
Good morning. I'm here representing Cambridge and Somerville Legal Services, and we're an organization that provides legal services for people that are having difficulties with evictions or housing and any kind of question that has to do with the law.
We're from Somerville, Cambridge Elder Services, and our table is about the different services our agency offers and the different wellness programs that we have, a fall prevention program, and some healthy workshops.
We're going to focus, Daphne has covered about everything that I have wanted to cover, so we'll be very short. No, it's going to be adapted to what happens during a blizzard or during isolation in the winter. Okay, this has come up last winter, which was horrendous. I noticed that most of my older patients had gained at least 5 pounds, maybe 10 pounds, and all admitted, even though they had no history of depression, that they got depressed. I got depressed. And now, people in the last couple of months have been coming in and saying, the Old Farmer's Almanac has said we're going to have a worse winter this year. Now, I don't believe that, but, you know, let's get prepared for it if that's the case. And so what I put down here is a very simple checklist to follow to help you get through a blizzard, all right, as successfully as you can. Now, I've been working on this. It's not a complete work. So if you have any suggestions, please put up your hand during my talk. If you have any suggestions, because when I've given it in the past, people have come up with some very good ideas, what they have done. So, okay, how do we protect our health during the blizzard or during the winter? Well, first is we want to fight off infection. So as Dr. Schneider said, get the flu shot. Everyone over 6 months needs to get the flu shot. Oh, yes, yeah, absolutely. Now, I hear in my practice, and I think it's very common, people will say, well, the last time I got the flu shot 5 years ago, I got the flu. Well, that does not happen. The person may have gotten a regular cold, but the flu shot does not give you the flu. There are some people who say, I'm allergic to eggs. There are ways around that. Ask your doctor. There's all degrees of allergy to eggs, but most people who have an allergy to eggs can get the flu shot. Eggs are brought up because actually the flu vaccine, one of the ways of making it is processed from egg cultures. All right. So what do you do if you do get the flu? Or before you get the flu, as a preventive measure, don't go near people, if you can avoid it, that are coughing. There's a magic 3-foot barrier. Any respiratory virus, if you stay outside the 3-foot perimeter, most likely you are not going to get the flu virus or a cold virus. But if you are around, let's say in the workplace, you want to be washing your hands frequently, because when the person coughs, they may have left the scene, but they've deposited those little viruses on your work table or sewing table or whatever. So wash your hands, you know, several times a day, and try to avoid putting your hands up here. This is not picking your nose, all right? It's a sort of a human reflex. We tend to do that. And that's just, if it's on your hands, it's going to get there, all right? So what do you do if you do get the flu? Well, if you didn't get the flu vaccine, you can say, your doctor's going to tell you, I told you so, all right? But beyond that, what do you do about it? Well, you keep yourself hydrated, you call your doctor up, and you tell him or her, I've had the flu, you know, you told me I wasn't going to get the flu. No, we don't say you don't get the flu, but at least if you get the flu, it's going to be much better than if you didn't get the shot, all right? So you tell the doctor that, and he or she should say to you, okay, I'm going to start you on a medicine that will fight the flu. Same idea as taking an antibiotic, but it works against viruses. And this really does a tremendous job. He doesn't want you coming into the office infecting other people and exposing yourself to worse things. All right, that's very important to remember. And the other point of taking the flu vaccine, it prevents heart attacks. So when you take the flu vaccine, it's not only preventing the flu, it's preventing getting a heart attack. It's been known for 100 years that people during the flu season have a huge increase in the population of heart attacks. And the reasons why weren't understood until fairly recently, but that's because basically the clots that are in your arteries sort of expand and get inflamed when they get the flu virus. And that's why that happens. So you're getting really a twofer. People who come in with the flu, there's a high rate of even silent heart attacks or full-blown heart attacks, and vice versa. Many people who come in have a low-grade level of the flu, but when they're tested, they're positive. So you're really helping a great deal. I won't beat this to death, but please get your flu vaccine. The other vaccine you should get is the pneumonia vaccine. I don't know how many have had the pneumonia vaccine. Okay, have you had the newer form of it? Yeah, okay. very important that if you've had the older vaccine, the 23 vaccine, that you get the 13 vaccine, because that covers more types of the pneumococcus than the previous one, and it's very effective. Okay, there's one other form of the vaccination. It's not strictly for blizzards, but you should have, because sometimes it's overlooked, is the shingles vaccine. All right, have you all had the shingles vaccine? Okay, all right, this is really a healthy group. You're gonna, I think 123 is gonna be the 122.5 years here. No, it shows what a great institution this senior center is, really, that you've been involved. It sponsors these programs, and it reminds people of what they should do. All right, so the flu shot, if you get the flu, get the antiviral agent. Don't have to come in. They'll call it into the pharmacy. Make sure you have the pneumonia shot, and you're set up for that. Okay. All right, so where do we go from here? Okay, and let me remind myself here. Okay, so what about the home environment during a blizzard? During the blizzard, what should you be prepared for? You know, basically, I think there are maybe a few of you were stuck in the house how long? Couldn't get out? 4 or 5 days? Yeah. Week? Okay. So you've got to provision yourself. You've got to have some kind of nutrition at home, because people get food delivered or get meals delivered. That's not going to occur, as you know, last winter. That was a real problem. And so try to have a stash of some food that doesn't need to be cooked, doesn't need to be refrigerated, you know, canned, I mean, but have it there, especially if you are diabetic, all right, because this is the problem. And the real strain in the system was patients who had run out of food, who were sort of brittle diabetics. What do? You know, and in that case, you call, or the doctor or the person calls the emergency numbers, and you have to activate that. But that is an emergency. You don't try to get through it by eating a Snickers bar, okay? But Snickers bars aren't bad. Any form of calories, really, during this. This is sort of breaking the fruits and vegetable rule, that you just keep yourself nourished during that time. So what else should you think about having at home, or having in your apartment?
Medication.
Medication, that's right. You should have, what's that? Yeah, keep your cell phone charged. Okay, why is it important to do that? Yeah, what do you really, what's the point, you know? Yeah, in case the lights go out and all, but also what do you want to do, use that it's a way of communicating, not just for emergencies, because that's the problem. The thing that hit me, and I think hits all the people who are isolated for a few days, that my life is disrupted. You know, I can't do what is necessary. But that is not true, okay, if you think about it. Very important, that is, Dr. Stein mentioned that you say socially connected. Well, how do you do it in this day and age? Thank God we do have the cell phone. And how many of you text even? Okay? All right. How many do have a cell phone? Okay, all right. So, you know, you sort of should, I'm sure you have a friend or someone that I use the term blizzard buddies, all right? That you can stay socially connected. And that makes all the difference in the world. There's just so much you can watch the weatherman getting, I hate that, 24 hours a day, and these guys are standing outside with a blizzard story, most stupid thing going on. All right, you've got to get your mind off the blizzard, all right? So it is talking to another human being. It's staying socially connected. So even when you have the flu, yes, it's good to protect others and even to get yourself rested up, but it's bad because you feel disconnected. So that you have the technology and the ability to stay connected, but you got to keep that cell phone charged. You know, and if you really want to get fancy schmancy, there's ways of, even when the power goes off, you can get charged. How many of you have like a crank radio? Yeah, that you crank up and power it that way. That's tremendous, because you can charge your cell phone off that crank radio, as well as staying connected. And I think, you know, it's really pretty inexpensive. But just if you use and are frugal with the airtime, you can make a modern cell phone last for a long time. Okay, so I'm not working for Verizon. Okay, but I think it's an extremely important thing because when we feel isolated, that's when we get depressed. And, not that you don't think well, but you don't think as well as you should. So if you're feeling you're getting depressed, you really should then reach out to that Blizzard buddy or make one during the time because the person you're calling up probably is getting depressed too. All right, so think of that. In home environment, what shouldn't you do? The heat goes off. What do you do? What's that? Okay, but let's say it really, really gets cold. It's... Yes? Newspaper? All right, but you do not turn on the oven, right? You do not turn on the oven. Why don't you turn on the oven? Well, you read it already, okay. But it is 5,000 cases of death a year in this country, usually during the winter because of that. All right, and that's probably underreported. So if you're, and you don't have to have the oven on. If you're in a building, an apartment building, maybe someone else has the oven on, the apartment below you, and you're starting to get a little woozy and you're not quite thinking right, open up the windows and think it may be that. Okay, because there's all range of symptoms. Okay, and it's a tragedy. Okay, and if it's like a wind chill of 40 below and it's not going to break and you have no heat, again you call an emergency number. In Somerville and Cambridge they're there, and thank God you're not out in Butte, Montana or someplace where there's no response. I know Butte may have a wonderful response, all right? But just picking on them, okay? And they probably living out there, they are used to the blizzards and used to the winters, so they adapt their lives. The other thing is, I can't emphasize, just reiterating what Dr. Schneider said, is that you can do your full exercise routine if you're stuck in the blizzard. And all that consists of walking down and back in the corridors of the apartment building. It's as good, just because you're walking inside doesn't make it any less beneficial than if you're walking outside or on a treadmill. You keep that up, and you do upper body strength building with doing curls like that with 5 or 6 pound weights, or just big heavy cans if you don't have the 5 or 6 pound weights. So you can eat, the only thing that probably suffers is the fruits and the nuts and things because they're not going to get them delivered or whatever. But everything else you can do, and that empowers you. Because I think Mother Nature is really powerful, and we feel like we have no power at all. We do. It's always great to be here. It's great to be... this is a great organization. Thank you very much.
Wow, what a great day. We are so tired, but it's been buzzing all day. The people that have come through the door has just been unphenomenal. It's been just crazy fun. So many things happened today. I want to thank all the vendors. I want to thank all the seniors for coming out and enjoying such a wonderful day. They went home with bags full of stuff, their bellies full, and just a lot of terrific stuff. Until next month, we want to say have a great day, and we look forward to seeing you.